So today I am excited to be joined by Fran. For those of you who don't know Fran, she is incredible MECFS, chronic illness, environmental and social justice advocate based in UK. She has had MECFS for 6 years, which was mild for 5 years, as has been severe for a year following a COVID-19 infection. Fran is currently focused on raising awareness and supporting the MECFS and long COVID community through her Instagram account alongside managing her own health. And thank you so much, Fran, for spending your limited energy to share your story with Open Medicine Foundation. And
Fine, thank you for having me.
And so I was wondering if you could start by telling us a little bit about yourself. How long have you been ill? And what was the diagnosis process like for you?
hmm Yeah, so I guess I've got quite a long story in that it technically starts when I was a teenager. So when I was about 15, I had suspected glandular fever, and then I had post-viral fatigue syndrome for just a few months after. But that was quite scary because I did learn about ME then, and obviously I was so young. It was I didn't know what was going on. I wasn't getting any recognition from doctors because that was kind of peak in the phase of like psychologizing everything, even more than they do now. But I did recover pretty much fully for over a decade, until 2018. So the start of 2018, I was had a very busy life. I was working full time as a veterinary surgeon. I was super active. So I'd been a runner for like years, but I was training for my first marathon, um, swimming, I'd done like a triathlon recently. Sorry, my cat's here. You might jump on the bed. And yeah, really, really active. And I just kind of got an illness, a really non-specific virus whilst I was marathon training, like at literally my peak of fitness. Um, and then I never recovered from it. And I recognized the symptoms from when I'd had post-viral fatigue as a teenager. So I did know I had an idea of what was happening. Just like feeling like I had the flu all the time. It was like a virus that never got better. Crashing. I would go to work, like push through my work and then crash afterwards. And all these like weird other symptoms as well, sleeping problems and things. Um, so my diagnosis then, it wasn't too bad. And I think that is because I kind of had an idea of what was going on. And I think also just like the privilege of being a veterinary surgeon and being scientific, although I'm a woman, so there's the whole misogyny element, but they took me more seriously. And I kind of was just like, I think this is what's going on. I knew how to get referred to the CFS clinic, as they call it, and we just did that. So it still probably took about 6 months. And when I was first diagnosed, they was even chat that I was too mild to be diagnosed. I was pretty mild at the start, and I didn't really have any cognitive issues. And I could still work full time, but it was just like I'd gone from running for a marathon and I'd kept trying to run and just completely lost the ability to do any exercise whatsoever.
So
Which was obviously
you did your research yourself or
a
something referred you to the clinic?
Yeah, they referred me to the clinic, but I guess I had a good idea already about MECFS, and I knew that I met sort of the criteria, and that I just needed to get kind of other stuff ruled out. So I had blood tests done. I didn't have much other tests done, and then I was referred to the so in the UK we have these like CFS clinics as they call them,
Mhm.
and they're not generally kind of run by doctors. They're run by like physiotherapists, occupational therapists, and they're very, very variable. Some of them are still behind with the NICE guidelines and still pushing graded exercise therapy. Mine was okay, but it wasn't very useful. Like they just gave me some advice around pacing. I had like 3 sessions and then I was left on my own really after that. The waiting lists were so long for anything else. They did have like a psychotherapist, which they did say was to help more manage like the mental stress rather than like as a treatment. But the waiting list was so long that they've removed me from it because they were like, yeah, it's too long. So that was that really. I was mild. It was okay because I didn't really have anything to do with my GPs. I'd go once a year just for some screening blood tests because I had a few abnormalities on my bloods. And then I could manage it myself. There was only a few occasions where I went into like a real dip where I would maybe go back and like get another test done. But I knew they wouldn't have any magic answers or know what to do with me. But I was mild enough that I could manage on my own. So for like 5 years, it was obviously like had a huge impact on my life. I ended up having to cut my hours working as a vet to 3 days a week and then to 2 days a week. So I still wasn't managing with the 2 days because obviously it's such a busy job, like on your feet all day. And then I'd work and then I would just crash the next day. And that was just like my life, like kind of work, crash, do something on the weekend maybe. But it was obviously, yeah, I could still get outside and go on little holidays and go to some gigs and yeah, it was a reasonable quality of life, even though it's not like there was any treatments or any help from medical professionals or any prognosis or anything. But yeah, then I got COVID in November 2022. And I had managed to avoid it until then. I kind of knew I was high risk, but like I assume it was the same everywhere really. Like no one with ME was advised they were high risk. Like we were never put in a shielding group or like given early access to vaccines, or certainly not easy access. So I knew I was high risk, but that was not under medical advice. And I think that's like such a huge problem that people with ME aren't being told that we're actually super high risk for COVID. So I did like carry on masking and stuff, but obviously I was working as a vet and I caught COVID eventually. And it was just, yeah, really, really horrendous. The infection itself was awful. Yeah, like just the worst kind of 3 weeks of my life, I guess. It just hit me so hard. And I was fully vaccinated. Obviously, I know that's a bit of a debate, but yeah, I was fully up to date with my vaccines. I'd been taking precautions, so I'd like done everything I could to be safe. But yeah, I was just so ill with it. Like, I had all the breathing problems and stuff, and the sort of like sore throat, a bit of a fever, but I had just way worse symptoms. Like that was when my POTS really kicked off and my heart rate just wouldn't drop for like days on end. I kept like blacking out or nearly blacking out. And then I started having paralysis episodes like a week or so in, and it was like my ME had just gone just suddenly to this kind of severe, very severe level, like very, very acutely. I just suddenly couldn't do anything for myself. I had to be spoon fed. Yeah, I was having these like adrenaline surges. I couldn't sleep. I literally didn't sleep for like 2 weeks. I'd sleep like an hour a night. Yeah, the neurological symptoms started like head pressure, vision problems, uncontrollable kind of tremoring, and yeah, these episodes of like just feeling like I was going to lose consciousness or like I was dying basically for like days and days and days on end. And I did go to A&E once. I went to the out of hours doctors once and was in touch with my GPs quite a lot, but it was like because my oxygen levels were fine, they were like, well, there's nothing, even though I was like so ill. there was not much they did. I managed to get some beta blockers because my heart rate was so high, and that was when I went to A&E. And yeah, that was, I mean, it was a fairly smooth experience in terms of we got seen quite quickly, but the doctor like insinuated that because I had ME that it was anxiety. It's like I don't have anxiety, like I'm just very ill, and I now have clearly I'm developing like a severe POTS. Yeah, and the GPs were pretty good. They kind of prescribed, it was all through the community. Like I was so ill, and I would be on like Instagram and Reddit pages and stuff asking like help, what do I do? Like I've got all of these like terrible symptoms and I can't cope anymore. Like I feel extremely ill, and yeah, it was all through the community that I got sent kind of advice and on drugs to start and things. And luckily my GPs were quite good and they did prescribe the stuff they could prescribe. But since then it's just been a very long journey, of like extremely difficult year last year, especially to sort of get to the point now where I could do an interview from my bed. But yeah, I'm still bed bound. And yeah, last year was, because I kind of improved a bit after COVID, and I was like, oh well, this is it now, I'm getting better. And then I just crashed again like 3-4 months later. And there was periods where I was just like on a downward spiral, just horrendous neurological symptoms that are really hard to describe. But I had like very severe vertigo, months where I couldn't even open my eyes or like focus on things for longer than a few seconds without feeling like I was going to black out. Like flashing vision, flickering vision, really intense like head pressure, just like the worst kind of head-based symptoms, on top of just like a drastically reduced baseline and the severe fatigue, or as we call it, but it's more than fatigue because I mean I had months where I just couldn't move, like I just really couldn't move my legs. Like I could move my legs like an inch, and I'd have crashes where I couldn't, just couldn't lift my arms at all. And
so your life dramatically changed after COVID-19 infection.
Yeah, very, very acutely and dramatically, and has not got back to anywhere near what it was pre-COVID yet.
And so would you mind sharing with OMF community what gives you the most hope on your bad days?
Yeah, there's a few things. There's been some very dark times, and like prior to this, like I've always had good mental health, and it's been very jarring just going into such a dark situation. I think, I mean, certainly knowing that people can improve and have improved, and like for me, I'm not, it's not really a focus on recovery. It's knowing that I can improve, like that things can be better than this. And when things were at their worst, that's what I had to keep telling myself. Like it can get better than what is happening right now. And knowing people who have either recovered or just, like I say, moved, say, from severe to moderate or to mild, it really gives me a lot of hope. And especially when it's happened in like, a kind of an organic way, like either with medications that now exist that help, or with time and pacing. I don't really find loads of hope from the kind of more pseudo-sciencey pathways. They've never really resonated with me, but I know people who have found meds that have really helped and things. And then I think obviously research, it brings me hope. And I think it's really hard because obviously everyone will keep saying, oh, there's really going to be a lot of research now with long COVID, and obviously for people who've had ME for decades, it's always hard to really believe that. But I do think obviously groups like the OMF that are doing or funding proper research that is, yeah, and we've got such a, like, we're starting so far behind because of how far behind ME research is, but there's definitely hope that it's like happening and that it can happen and continue to happen. So yeah, and then I think just the community, the online community definitely has kept me going. Like on my hardest days, like I say, I would message like in desperation, and these people who I hadn't even spoken to before would come and help me and like send me messages or send me voice notes, even just like being there for me, even if it wasn't advice. And now I hope that I can do that for other people now that I've got a little bit more capacity. And yeah, we've got various groups and things, message groups of things just to help support each other. And yeah, the community definitely always kind of gives me hope.
So what is one thing you wish every person would understand about chronic complex diseases such as ME, CFS, and long COVID?
Obviously there's so many things, it's really hard to pick, but I think I find it really frustrating when people don't understand the historical kind of injustices that is linked to ME and the history of ME. And when people kind of say long COVID's a completely new disease, and I know there's elements that are new because of COVID is a novel virus, but I think everyone, obviously everyone who talks about ME, but ideally just everyone really needs to understand like what has happened the last few decades, why we're at this point, because it is because of neglect and stigmatization and individuals even who have pushed this incorrect kind of biopsychosocial model on ME patients and have delayed the research by decades and harmed so many people. Obviously with the PACE trial, and yeah, I think I would definitely wish that people would understand just a bit more around the context of the injustice, the historical injustices that, and now why ME patients face so much stigma and neglect still, and medical misogyny as well. That would probably be my number one, but there is obviously many others as well.
Fran, thank you so much for joining us today and for sharing your powerful story. And it's May Momentum for Open Medicine Foundation, so please share this story and help us raise awareness about ME/CFS.